The way in which Namibia is looking at the issues of health, public health security, is based on the lessons that we learned during COVID. We have learned that we need to be ready and have our systems for response and preparedness firmly rooted in the best practices. Mm-hmm. So as far as our ways of dealing with these public health threats, we have our surveillance systems in place. We have laboratory capacity that we established, including capacity for genomic sequencing. We have built isolation facilities so that should cases of infectious disease be detected in the country, we are able to treat and we are able to isolate these cases. We have trained our healthcare workers both for case management and also for diagnosis, so that in cases of outbreaks such as Mpox, our healthcare workers at health facilities are operating with what we call as the high index of suspicion. Mm-hmm. So if somebody comes to a health facility with symptoms that are consistent with symptoms of Mpox, for example, this person is quickly isolated. We take the samples, we send them to the laboratory, and we test to confirm whether this case is in fact what is being suspected. We have also put in place measures to be able to, for example, provide for medical countermeasures so that we treat either in terms of supportive treatment for these diseases and infections, or if there is a specific pharmaceutical product that is required, we should be able to have that. In the case of Mpox, of course, there isn't a readily available antiviral medicine. I think there's a medicine that was approved by the European Medicines Agency, but that specific medicine is not specifically or readily available in many areas. Mm-hmm. We, for example, also here in Namibia do not have as yet access to the Mpox vaccine. Mm-hmm. But as I indicated, our healthcare workers are trained to provide supportive treatment in terms of treating, for example, core infections that patients may have. But that is really where we are. So our surveillance system is in place. We have the means to receive complaints from members of the public. We have a specific toll-free number that the people may call. We have got surveillance capacity at our ports of entry, for example, so that we are able to screen those individuals coming into the country. And if there are suspected symptoms, we are able to pick them up.